Hello everyone. Good evening. Welcome to the channel Hospital. It was just after sunrise when another hectic shift began in intensive care unit. Every bed was occupied. Nurses hurried from one patient to another. Monitors beeped constantly, and doctors moved quickly between the emergencies. It was one of those mornings when everyone knew there would barely be a moment to sit down. Then the ambulance doors opened. A young man believed to be in his late 20s was rushed into the emergency room. What caught everyone's attention wasn't just how sick he looked. It was the fact that he was a doctor himself. He was completely unconscious. He didn't respond to his name. He didn't respond to pain. He couldn't tell us what had happened. Following closely behind the stretcher were his father and two sisters. Their faces showed pure fear and confusion. "We don't know what happened," his father repeated over and over. He was fine. Then suddenly he became unconscious. Within seconds, the trauma team went to work. IV lines were started. Blood samples were collected. Vital signs were monitored. Emergency medications were prepared while multiple specialists gathered around the bedside. Because the patient couldn't speak, every answer had to come from his family. The first laboratory reports arrived. One result immediately stood out. His liver function tests were severely abnormal. The numbers were alarming. The room became noticeably quieter. The doctor exchanged concerned looks. When someone this young develops sudden liver failure, physicians must quickly consider many possible causes. One of those possibilities is alcohol-related liver injury. Another is drug toxicity. A senior physician gently turned toward the family. "We need to ask you some difficult questions." His father nodded silently. "Did your son drink alcohol?" "No." "Did he ever use recreational drugs?" "No, not that we know of." Another doctor asked similar questions. Again, the answer was same. His sisters looked uncomfortable. One of his sisters told us that our father sold his whole property to fulfill our brother's study expense. Finally, one of them explained something that made the situation even more confusing. "He hasn't lived with us for almost 3 years. He stayed away from home. We only spoke occasionally on the phone. He never really told us much about his personal life." That single sentence changed the atmosphere. Since the family couldn't provide a complete medical history, uncertainty filled the room. As news spread through relatives and family friends, visitors began arriving at the hospital. Instead of offering comfort, many arrived with assumptions. If he stayed away from home for 3 years, he must have been drinking. Maybe he was hiding an addiction. That's probably why his liver is failing. No one had any proof. No one had seen medical records. No one knew the full story. Yet opinions spread much faster than the facts. His father sat quietly beside the bed. His sister listened to those comments without responding. They were already terrified about losing someone they loved. Now they also had to hear people questioning his character. Meanwhile, inside the ICU, the medical team continued searching for answers. Every possible cause was investigated. Additional blood work was ordered. Imaging studies were reviewed. Specialists discussed different possibilities. Still, one critical piece of puzzle was missing: his medical history. Without it, every decision became more difficult. The first day passed, then the second. His condition remained critical and the patient was on ventilator. On the third day, something unexpected happened. One of his cousins, who is also first year medical student in same university, arrived at the hospital. She looked nervous but determined. "I think there's something important you should know," she told the medical team. I believed he was being treated for cancer. The room became silent. "Cancer?" one physician asked. "Do you know what type?" "I'm not completely sure," she admitted. "I don't have any reports, but I know he was receiving treatment somewhere." It was the first real lead someone had. The cousin immediately contacted one of the patient's closest friends. The friend still lived in the same hostel where the young doctor had been staying during his training. Several hours later, he arrived carrying a folder. Inside were medical reports, hospital discharge summaries, laboratory tests, treatment records, and everything the team required was in the folder. The physician carefully reviewed every page. Then they found the diagnosis: stage 4 Hodgkin lymphoma. He had been fighting cancer quietly, privately, without telling most of his family. The records also confirmed that he had been undergoing radiation therapy as the part of his treatment. Suddenly, many unanswered questions began to make sense. His prolonged absence from home, his secrecy, his declining health. None of it had been because of alcohol or drug abuse. He had been carrying the burden of advanced cancer while trying not to worry the people he loved. The assumptions that had spread through the waiting room now felt painfully unfair. The relatives who had confidently blamed him fell silent. There was nothing left to say. The truth had finally arrived. His father slowly looked through the reports with trembling hands. One of his sisters couldn't hold back her tears. "We never know," she whispered. "He never wanted us to worry." For the medical team, the discovery was more than just another diagnosis. It completely changed the clinical picture. The patient's previous treatments, his cancer history, his medical records became essential pieces of information for guiding his care. But beyond the medicine, this case left everyone with a lesson they would never forget. Hospitals are filled with stories that no one can see. Not every patient can explain what they are going through. Not every illness is visible. And not every person who lives differently is hiding bad habits. Sometimes they are simply fighting battles they choose to fight alone. As healthcare professionals, we learn to search for evidence before reaching conclusions. As human beings, we should do the same. Because behind every hospital bed is a story, and sometimes the truth is far more heartbreaking than the assumptions.